welcome to today's COVID-19 update. We speak with the Honorable Minister of Health, Dr. Frank Anthony.
Well, we continue to do work at the Ocean View facility. And as you know, we have patients that are there. They have been housed, but these are milder patients that do not require ICU care. And so we have been able over the last couple of weeks to have those types of patients there. And if they require ICU care, then we'll bring them back to Georgetown Hospital. But we have now started a second phase at Ocean View. And the second phase is to ensure that the ICU at Ocean View is up and running. And for us to do that, we need to install medical gas, the lines for the medical gas. And so we have had uh, one of the contractors come in and start the installation of those lines. We are also required to put in suction so that if you need to extract anything from a patient, then you have proper suctioning uh, to do so, and that also requires specialized types of equipment. So we have run the lines to be able to do that as well. The project is not completed as yet because there are pieces of equipment that we have to import, and the contractor is right now trying to get those pieces of equipment into Guyana. But the physical lines, they have already installed those, and when we get the pieces of equipment, we just have to attach it, and we'll have that ICU up and running. Our expectations are that we'll be having about 29 beds in that unit. Some of it would be more for ICU patients, and then we have a section where we'll have high dependency patients. So there are like two categories of patients that we'll house there, but the overall unit would have 29 beds. After we complete that, we are also working on getting our X-ray unit at Ocean View up and running, and some other forms of diagnostics that we'll need to have in place once we have an ICU facility there. So that is an ongoing job that we have there. In addition to that, there's also a theater, and we are sourcing the equipment to put that in place where the theater is going to be. So there are lots of work that is happening, and while we are doing some of the physical work at Ocean View, we are also spending resources to acquire the equipment that is necessary. So maybe in about 2 to 3 weeks, we'll have everything fully functional. But that's dependent on once these equipment come into Guyana. In addition to that, you would notice that over the last couple of days, we have had a substantial donation coming in from PAHO. We have had 5 ventilators from PAHO and 24 oxygen concentrators. So this we have already started to deploy them. And in addition to the 5 ventilators, we have also received 21 more ventilators through the Indian grant. So we have already started to deploy these ventilators. Georgetown would receive another 9 ventilators from us, so that the current ICU at the Georgetown Public Hospital, they would have a full complement of ventilators, and if they need to use this on their patients, then ventilators would be available for such use. Oxygen concentrators, we have already started to deploy some of this, and we want to send these oxygen concentrators more out into the regions because it is quite expensive to transport oxygen to those regions. And with these oxygen concentrators, what would happen, they take ordinary air and they're able to extract oxygen from it and concentrate it. So that's how the principle on which it works. They take the air, separate out the nitrogen, And so you have more oxygen in the air that comes out to the other end. And so this is something that we think going to make a big difference, especially in the interior communities.
In terms of the communities outside of Georgetown, is there a particular system you're using in terms of who gets it first?
What, the
The
ventilators?
ventilators, yes.
Every region is going to get ventilators because we have enough. And so we're putting it at the regional hospitals to make sure that every regional hospital have the capacity to provide ventilation care if it's necessary.
Minister, we noted that the figures have gone up a bit, and we know that you've been off on an education campaign. Just an update, how is that campaign going? And in cases where persons may not necessarily uh, adhere to the guidelines, what's in place for that?
Well, the education program is an ongoing one. We have these updates that we do. We have some of the doctors who have been involved in the care and treatment of patients. They have been making public statements and trying to educate the general public about COVID and how the disease is transmitted and so forth. So that's an ongoing effort. We've had persons who have been in different parts of the response mechanism, so like people from the lab talking about laboratory diagnosis and what you need to do and so forth. And we have had a lot of people talking about the prevention aspects of COVID. Now, I think we have saturated the country with that prevention message. By now, every child in this country should know that to prevent COVID, you have to wear a mask, you have to keep your social distance, and you have to sanitize your hands. I think everybody now would know those three principles that we have been trying to get over to people. The challenge, however, is that while people now, the awareness of these things have gone up tremendously, it is to get people to practice them that is sometimes more difficult. So you can have awareness, high awareness, but to effect behavioral change is more difficult. And that's what we are seeing now because people are quite aware of what they need to do, but they are not practicing what they know. And this is something that we have to pay more attention to, and hopefully we'll get people to understand that it's not just knowing the information, it is practicing the information. So, for example, when you go into the markets, the vendors know that they have to wear a mask, but many of them, they have the mask in their pockets. So when you ask them, why is it that you're not wearing your mask? Then they would say, well, I'm taking a break, right? Well, you don't know who is that person coming to your stall and whether or not they are infected with COVID and they can transmit it. So you have to be cautious all the time once you're in the public space. And hopefully we'll get people to be more compliant. As we have said before, through the operation that we currently have, Operation COVID Curb, that if we see errant businesses, they would be given a warning, and the second time around, that we'll be closing those businesses because people have to start taking this thing about transmission of COVID very seriously. So, one, we want to warn you, we want to tell you what the mistakes that you're making, and then the second time, if you don't comply, then we'll shut you down. So these are very stringent measures, and we are hopeful that people would comply rather than we have to take these other stricter measures. There's also provision in the law that if people do not wear their mask, that they can receive fines. Again, we don't want to go to that extreme, but if people are persisting or not wearing the mask, then we'll have to take those other measures. So hopefully with education, with peer pressure, with everyone playing their role, that we'll get more people to be compliant rather than us trying to go and enforce measures when we know people should do the right thing.
Yes. As we wind down, um, for just for information purposes, have there been any increase in any particular region?
We have seen cases, number of cases, and we'll see spikes going up. Whether it's a big increase or not, that's debatable. But in Region 8, I think there were some questions pertaining to Region 8. We have seen today about 22 new cases, or 22 active cases rather. That would be inclusive of the new cases that we've had over the last 24 hours. Again, we have put mechanisms in place to be able to manage the cases. We know exactly where these cases are from, how many are from these locations, and we have sent teams to these locations to ensure that the people in those communities are aware and that they take extra precautions. So once we identify um, places where we're seeing cases, we will send in our teams to help with or to intensify the education effort. And if there's need for extra medical assistance, our teams would be deployed to provide that extra medical assistance. Of course, once we identify an active case, we will do contact tracing. So persons who have been in contact with these active cases, we will then ask them to go into self-quarantine. And in some cases, if they've been really exposed to the patient, then we would advise that they do a test, and we'll be able to um, do that test and see whether the person is positive. We have, on another note, we have increased our capacity now at the National Public Health Reference Lab, so testing shouldn't be much of a problem. As I told you before and last week, you would have covered some of the events where the Chinese government has donated an automated extractor. With that piece of equipment, we have started using it, and I can tell you that we are now able to extract 96 samples within 45 minutes. So our processing time has gone up tremendously. So we'll be able to do more samples in the time frame that we used to do them before. So before we were taking 8 to 9 hours. Now, because of we are using this automated extractor, that time has been drastically reduced. So we're making progress, and the staff at the National Public Health Reference Lab has been, you know, utilizing this new piece of equipment, and we have another one that is on the way coming to Guyana. So when we get that, we can even do more samples. So our capacity at the lab would go up tremendously.
And that no doubt is good news, very good news for the population. Sir, just one last question. The airport has opened and, you know, persons are still concerned, but could you just explain briefly, you know, we know that persons are coming in, but they would have already been tested, so it's not like they're coming and they're infected.
So a requirement for travel into Guyana, that that the most important requirement is that before you travel to Guyana, you must get a PCR test, and that test must be negative. If it's positive, you would not be allowed to come here, right? So that's important. So you must get a negative PCR test. And then, if you had that test within the last 72 hours, when you land in Guyana, you would be allowed to proceed without a second test. If the test, however, that you have is more than 72 hours, then you would be required to do a second test here in Guyana at the Chadijagan International Airport. Upon taking the sample at the airport, then you would be allowed by the officials there to leave the airport, but you go home and you are in quarantine until you get your results. And those results would be communicated to you. We think it would take within 6 hours you should be able to get back your results, and so that result would be communicated to you. Once you are negative, then you can go about your routine business. If, however, you're positive, then we have a whole set of protocols that are in place where you'll have to be in isolation, and every person that you have come in contact with, we'll have to quarantine them. So there is a very rigid protocol that is in place, and we are enforcing that protocol.
All right, Minister, thank you so much.
Thank you.
Well, that's it for today's COVID-19 update with the Honourable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, our social media platforms as well, and of course, the Ministry of Health's website and social media platforms. Thank you.